After we've completed the surgery successfully, let's discuss your recovery. We will prescribe the pain meds and muscle relaxers for you to help get through that initial hump and have you shower typically about 3 days after the surgery, even with the drain still in place. As we mentioned, those drains will typically be removed approximately 10 to 14 days after the surgery, depending on how much drainage there is. When we see you at your first week post-op visit, we will remove the steri-strips that we placed during the surgery and start some special microporous tape and some of the SkinMedica scar recovery gel that helps us to control those scars in the early healing process. By using this scar treatment modality, the risk and need for scar revisions, whether it's with steroid injections, microneedling, or broadband light treatments, has been greatly reduced because of the scar recovery gel. We will do whatever we need to do, however, to get those scars hidden and camouflaged as best as possible. Any incision that I place on the breast will be hidden underneath a bikini top, a bra, or any clothing that you're going to wear, so they won't be visible. There are a couple other tricks that I have found that can certainly help with your recovery. Using topical ice can help with the inflammation. Even though you may not feel it through the dressings, it's still getting down to the tissue and reducing some of the inflammation. I will also give you a special gift bag that has some things that I believe will help with the recovery. One is a homeopathic Arnica montana that can help with swelling and bruising. Another is a lavender scented candle that a dear friend of mine makes for us, so we can have you burn that and help with the relaxation. So anything we can do from a holistic, natural way certainly can help with that recovery. As far as return to normal activities, we don't want you to get your blood pressure or heart rate up in the first 2 weeks after the surgery to reduce the risk of bleeding or hematomas. If you're on the narcotics or muscle relaxers during the day, obviously we don't want you to drive. If you're taking them just to help sleep at night, but not during the day, you should be okay to drive at that point. You will have some discomfort, but typically not as much as you had with the initial implantation, as there isn't the volume of tissue or the implant stretching the nerves and your native tissue. After we get you over the initial 4-6 weeks of recovery, then we start to focus more on the mid-range and the late-term recovery. We will continue to follow the scars of the breasts, the shape of the breast, and the softness, because things change over time. We will follow those ribs coming back out and see how the breast fluff and become more natural. There have been a couple patients, however, that approximately 4 to 6 months after the explantation, physically they're feeling so much better. They have their energy, able to do so many more things. However, they look in the mirror and those body images come flooding back. If that happens, just know that it might occur. And if it does, give me a call and we'll talk through that. As we continue in the post-op recovery, we will follow your inflammatory score at 6 weeks, 6 months, and a year. And my staff and I get so excited when we see our explant patients on the schedule, and we can't wait to see how much that score has dropped. And most times, you, the patient, don't recall how inflamed you were. And when we tell you what your previous or your pre-op inflammatory score was, there's just a huge smile because you've seen how far you've come. If there are some issues with size or shape or volume, one thing that we can offer once you're healed at 9 months or a year is to do some fat graft breast augmentation, where we do liposuction and take some excess fat from other areas of your body, which makes those contours look better, and then repurpose that fat by putting it back into the breast. Oftentimes we do that on the upper part of the breast or the inside of the breast, where we typically lose that volume. What I find is approximately 60 to 70% of the fat that we place, that we transfer, stays there permanently, and approximately 30 to 40% gets absorbed. We can get a nice, subtle change to make things look more balanced and a little bit more natural. We can't go up more than about a cup size with each one of these procedures. However, it is a nice way to be able to even things out. What I have found is only a handful of patients want to do that. Most of the patients are so happy to be back to their baseline health and have their lives back that they're done with anything with the breast and they begin to continue to live their lives.